New to Medicare and confused about Medicare supplement plans? Take a quick journey with me through the offerings in Medicare supplement plans and make a more informed decision. First things to keep in mind with Medigap plans is that they are meant to add more coverage to original Medicare, which is only Parts A and B. Part D is not off the table for you, but Medigap isn't really designed to support Part D, nor is it considered part of original Medicare. While original Medicare will pay for many health services and supplies, it generally will pass some of that cost on to you in the ways of copays, coinsurance, or deductibles. And for those of us who would like another plan to pick up some of those costs instead of being responsible for them completely, we are going to be looking into a Medigap plan for that. So here is a list of all the things supplement plans can cover. But what does that mean? Let's get deeper into this. Most plans will cover things in full, while others will cover a portion, but we will talk about that in another video. We'll talk about all the supports for Part A first, then the supports for Part B. The first thing we want to talk about is the hospital deductible. The exact amount changes from year to year, but is well over $1,500. So if you have standard Medicare and wind up in the hospital, you are stuck with paying the deductible in full before Medicare helps you out. But with a Medigap plan, that deductible will be paid for you. Next is the coinsurance associated with Part A. As we already know, coinsurance is the percentage of cost we pay when we receive care or supplies. These amounts are going to change depending on what service or supply you're getting and what year it is, but the main focus is going to be things like hospital stays. Hospital stuff falls under Part A, doctor stuff falls under Part B, but we'll get to Part B later. So that's the first thing that can be covered. The next support is for blood. If you ever are in a circumstance where you need blood, your first 3 pints will be covered by your Medigap policy. Why the first 3 only, you ask? Because standard Medicare will cover after the 4th. But unless you have a sup plan, those first 3 are on you, and they can get pricey. Next, we have skilled nursing facility coinsurance. If you wind up in a skilled nursing facility, a Medigap plan will cover days 21 through 100. Why those days? Original Medicare strikes again. They pay for the first 20 days. Hospice is a similar situation with Part A covering that too, but maybe not some of the services you might receive while in hospice, such as respite care or some prescriptions. Medigap steps in here and covers those. For the most part, we can do a rinse and repeat for this for Part B, with one big exception. Part B coinsurance after the deductible is met can be covered partially or in full by a Med Sup plan. Remember, Part B is like doctor office services like x-rays and labs, durable medical equipment, and hospital outpatient services. Part B excess charges are also covered by Med Sup plans. What are these? Excess charges are when the doctors charge his or her patients up to 15% more than the assigned Medicare cost of treatment. So with a Med Sup plan, those costs can be covered for you too. Said there was one exception. Notice that I did not mention that the Part B deductible can be paid for by a Med Sup plan like I did with Part A. If you were born after 1955, plans F and C, the only 2 that offered this benefit, are no longer available. There is no way around it. We will have to pay our Part B deductibles no matter which sup plan we choose. Here's sort of a wild card benefit: emergency travel care outside of the U.S. Many plans will help you pay for up to $50,000 per lifetime for any emergency care needed while traveling outside of the U.S. So those are all of the benefits you can count on being included to some extent within Med Sup plans. Part A and hospital deductibles, Part A, B, and hospice coinsurances, Part B excess charges, 3 pints of blood, and traveler's emergency care. If you want a deeper dive into the plans individually, check out our video on that. At the end of the day, when it comes to Med Sup plans, the best way to save is shopping around between carriers. There's no escaping that. But if you can understand some other stipulations, you might be able to save yourself even more money, especially if you are planning your healthcare journey long term. Understanding these and other healthcare elements will help you choose the best sup plan for you. For more information on Medigap plans, be sure to watch the rest of the series. Thank you for watching.